Hi, I'm Kimber Mahon. If you've been exploring this website, you may have seen me hosting the Life Beyond Bunions show. When I hosted that show for Dr. Moy, I interviewed a lot of his patients, and I was really excited to hear their outcome of their surgery. The reason for that is during the show, I exposed the fact that I have 2 bunions myself. Okay, I have to take this opportunity because I'm going to be a little selfish here. I have a secret of my own. I have 2 bunions. And my right one is worse, in my opinion, than my left. Would you mind looking at it?
Not at all.
Okay.
Well, yes, Kimber, you do have a bunion. And as you can see, a bunion right here is an outgrowth of bone there on the side of your foot. Let's take a look here. This is where the pain generally associated with bunions occurs. A lot of times it can come over here as well. I like to evaluate the range of motion of the joint to make sure it's smooth and fluid, that there's no crunchiness or crepitation occurring within the joint. And, how much snappiness does that tendon pull over? There's a lot of things that I can look at a foot within a matter of 2 minutes and surmise exactly the procedure that I performed for you.
I had actually talked to previous doctors in the past, and I was never satisfied with the results of the consultation alone, so I never had it done. But this convinced me. So, just recently, I had my left foot done. And what I'm going to do right now is I'm going to take you through the journey of my entire experience, from the time of consultation all the way to the time of my hotel stay. All right? Here we go. I stayed in a hotel not too far from Dr. Moy's office. It's just a couple blocks. It was an easy drive in, and because of the download button on the website for the forms, I had already filled them out, so I had them with me ready to go to give to the receptionist.
Hello, how are you?
Good.
Go ahead and sign in your last name.
Okay.
And do you have your new patient forms as well?
Oh, I do.
Okay, thanks.
As a side note, it's a real time saver if you go on the website and click on patient forms, print them out, and have them filled out before your visit.
And do you have your insurance card? Thank you. And go ahead and have a seat. It'll be a few minutes before they bring you back. Thanks.
Now, I have to say I was nervous going into my consultation, not knowing what to expect. But when I sat down and I saw these 2 ladies that were there who had just had their surgery and they were in for their follow-up, they put me at ease.
Have you had any pain?
Mm-mm.
Me neither, none at all.
And you both just looked completely
No,
fine.
it wasn't bad.
Yeah.
The anesthesia is real easy, and it doesn't take very long, about a half hour.
But I think it's worth it.
Yes.
I'm hoping.
He's really, really good. So.
Yeah, when are you doing yours?
Mine is on Tuesday of next week, so today's my consultation.
All right.
Yeah.
I do all the labs and.
Yeah. So tell me about your surgery. Like, how did you feel the next day, or how was your weekend? I mean, you had to give up a weekend.
Mine was a breeze. I just kept it elevated nice all weekend,
Uh-huh.
and I didn't do anything. I didn't try to walk on it. So.
Mine was easy too.
Forced relaxation. Watch a lot of movies. You know.
I wasn't quite as good. What's your name?
Lisa.
I'm Chris.
Hi, Chris. Nice to meet you.
And you're?
Kimber.
Hi. I wasn't quite as good. On the night after Friday night, I went to a little party at my neighbor's, but I was good there. I kept my foot elevated. But the next night I went to a wedding and had to walk further than I had planned on walking. And I kept my foot elevated for the most part, but you're up to get a drink, you're up to go to the restroom. And I totally actually felt like doing a slow dance, but, I did refrain. I just figured.
Now, one thing I want to express to you, when I went in for my consultation, I was nervous. And then when I sat down to speak to these 2 ladies, it really eased my mind to see that they had had surgery like 3 days ago. And to speak to them and hear their stories, and even one of them went to a wedding during the weekend. So that just let me know that I made the right choice.
Yeah, that's it. I'm planning for a ski trip
I
in
know.
March.
That's why I want to get it done before the end of the year, both of them, so I can go skiing.
Work around the ski trip, work around the summer. So I'm done with my second one by next summer. So.
That's what I thought too.
So you're going to do your second one as well?
I'm planning for end of March. We'll see.
Yes.
Oh, really? That long? I'm hoping to do it December.
Back to back.
Yeah.
Yeah, I mean, everybody I've seen this weekend and even leading up to it, they kept telling me, oh, bunion surgery is so hard to recover from. And then you hear these horror stories about people not going back for their second foot because it was so bad. I think I've even heard about botched bunion surgery where, they never really totally recover. And other people I've heard, I don't know these people, but they said their bunion grew back. I've heard about that. Did you ever hear that?
Yeah, I have heard that. I haven't seen it, though.
Yeah. Yeah, no, in fact, I teach over at Saddleback College, and the first day I noticed a girl with one of these boots on, and she had bunion surgery, and she was still suffering, and now she's thinking that she was going to go back after 3 months, and her 3 months is almost up, and she just is not up for it. Mm-hmm. So I feel like today I'd go back. I did look at his website, and he does have out-of-state patients.
Yeah, I noticed that. So people come from all over to... It says something. It says a lot. So
it does.
Yeah. I think I probably wouldn't have done it because I'm a little fearful of it, but my sister had it done, so it was a breeze.
And she had it done how long ago?
A long time. I think she said 2000, 2001.
Wow. And he was doing
Is she wearing the great shoes and all
Oh,
that?
yeah. Yeah, her feet are beautiful. I'm jealous. So.
Without pain.
Yeah.
I can't wear the high heels. I'm in pain if I wear the high heels.
Mm-hmm. Same here.
Do you have pain? I'm really here more for cosmetics before just a
I
little
did
bit of
off
pain.
and on, and we went to Walt Disney World, and we were on our feet all day, and my feet were killing me. That was when I knew that's it. Or if I go on long hikes too, my feet really hurt. Mm-hmm. So.
Even though I'd spoken to Dr. Moy's patients before, speaking to them after they'd had surgery just days before, I knew that I'd made the right decision.
Kimber?
Yes.
Would you like to come on back?
Yep.
How are you doing today?
I'm good.
Good. You get to come on back with me.
Okay.
I'm Jordan, by the way. I'm one of Dr. Moy's assistants.
Nice to meet you.
Nice to meet you. Go ahead and slide all the way back there. I'm going to lift your chair up for you.
So after talking to the two ladies, I was called back for my consultation. And I have to tell you, being in Dr. Moy's office, it's very large, and there's exam rooms when I'm walking through the hallways. Everyone's very professional. I met Jordan here, and he proceeded to make me comfortable in the chair, and I could already tell he had a lot of knowledge about what he was doing.
Okay. Can you go ahead and point to the spot that hurts the most?
Here, and then right in here.
Okay. So right across where your shoes rub?
Pretty much.
Okay.
Mm-hmm.
When do they tend to bother you? Is it when you stand, walk?
When there's a tight shoe, like even these that I just took off.
Okay.
Will go ahead and create that pain. And then it was strange. The other night, I was sleeping, and of all things, it just pierced out of nowhere.
Okay. So it's a sharp kind of shooting pain, would you say? Okay.
Yeah.
All right. And you said that's been going on for how long?
About a year and a half.
About a year and a half. Okay.
Mm-hmm.
Have you been to any other doctors for this before?
I have, actually. It was probably 2 years ago, roughly. And I went and I actually saw a podiatrist, two podiatrists, an orthopedic, and I don't remember if the other one was another orthopedic, but I interviewed 4 doctors and decided on an orthopedic.
Okay.
But then I chickened out.
Okay. So as far as treatment goes, you haven't had anything done to your feet yet?
No.
Okay. How do they feel when you're not wearing shoes or, say, you're in a tennis shoe?
Tennis shoe is fine, but again, if I've been really active, I might get that pierce again. When the pain comes, it's not something that stays for like 10 minutes or anything. It's more of a ow, and then it goes away.
Very sharp, very quickly.
Mm-hmm.
Okay. Well, what I'm going to do here is take you back around the corner. We're going to go get some x-rays done. We'll get those developed and get those ready for Dr. Moy, and then he's going to come in and talk to you.
Okay.
Okay. So you get to come on back with me.
Okay.
I'm going to have you go around right over to the other side of this box here. I'm going to have you stand up here so your right foot's on this side, your left foot's on this side. That's it. We're going to strap this on around your waist. Slide this foot all the way against the plate. Okay, very good. I'm going to have you turn so you're facing the other direction. All right. And you're all set. You can step down off the box. You can slip your shoes back on, and we're going right around the corner.
Okay. Now here I get to have my blood drawn, and I have to tell you I'm a little squirmish when it comes to a needle.
Just keep your arms straight there for me. I'm just going to tilt the back down just a little bit and just relax there. Just keep her there you go. All done. Go ahead and hold that there for me. Just put a little pressure.
Now I want to note, for those of you who are out of state or out of town, even like I am, you generally want to get your blood drawn in your home city. You don't want to have to travel all the way to Dr. Moy's office for your surgery and find out there's something wrong. This saves you an extra step.
All right.
All right, thanks. Hi. So here I met with Penny, and Penny, she goes ahead and goes through making sure that you got all of the procedures before and after, and you're sure of your appointment time and your date.
And it tells you when to check in, what time, and everything in the brochure. You have an option to buy a shower protector.
Oh, here's something that you definitely want to purchase. Penny offered the protective boot. This helps so that you can take a shower right after surgery. I strongly suggest you get it. It helped me tremendously.
Put it on or off.
Okay, perfect.
Okay, and then we need to make your follow-up appointment with us for your surgery's on the 17th, so we would need to see you on that Friday.
Do you have something in the morning?
Let's see what we have for you. I have a 9 o'clock.
Yeah, morning would
That
be
work for
great.
you?
Yeah,
Okay.
thank you.
And do you know where to check into the surgery center?
It's the other doors opposite of the one I came in?
Yes, the double doors with the symbol on the front.
Right, okay.
Okay?
Super. I might be calling you a couple times.
Okay, that's great.
Okay. Great. All right.
You're all set, I think.
All right. I'll see you next week.
Okay.
Okay.
All right.
Thanks.
Bye-bye.
Bye, Kimber. See you next
Bye.
week.
Thanks.